Hey there, are you a Medicare beneficiary living in the state of New Jersey and looking for a way to potentially save some extra money? If you fall into that category, this is a video you're probably going to want to check out. My name is Rocco Cilio, all-star insurance specialist, helping what I call the vintage age generation worry less and live more all throughout the year, not just during enrollment season for their insurance. And in today's video, what we're going to do is talk about somewhat of a little-known program in the state of New Jersey, certainly an underutilized program that I estimate somewhere's close to half of all Medicare beneficiaries could potentially be eligible for. And unfortunately, only a small percentage who could qualify for this program are participating. So it's called the Pharmaceutical Assistance to the Aged and Disabled, or what we call in the insurance world, the PAD program. And this program is designed to help individuals with disabilities as well as older adults, or what I call the vintage age generation, and you know who you are, get some help with their prescription costs. Well, what does that mean? What kind of help? How about help with getting copays taken care of at reduced amounts? How about having deductibles covered? How about having the premiums covered? And even for those of you that might have one of those dreaded Part D late enrollment penalties that you have to keep up with every single month, imagine having a world where that doesn't exist anymore if you qualify for the PAD program. So we're going to break it all down over the next few minutes. We're going to show you exactly what the eligibility requirements are. We're also going to talk with you how, when you have this PAD program, how does it coordinate with the existing prescription drug coverage that you may have in place now. We're also going to show you how to apply for the program and make sure that you have all the necessary paperwork that goes along with it. Now, for some of you that might not wind up being eligible for this program, fear not. There's two other points that I'm going to add at the very end of this video where you're going to get some value from. First of all, there's a secondary program to PAD for those that might exceed the eligibility requirements, but still have a chance to be able to save some money. We're going to talk about that program as well. And then also, I'm going to share some information about, even if you can't save money with either of these programs because you're not eligible, there's still some ways that you'll be able to take advantage of where you can actually manage the cost of your prescription drugs better throughout your plan year, help you with budgeting and really have more control over your money. So we're going to talk about that at the end as well. And everybody that has Part D prescription, whether it's standalone or through your Medicare Advantage plan, you're able to take advantage of that. So stay tuned for that information. I'm excited. So let's just get to it. Okay, listen, before I explain how PAD works, I just want to make a mention that there are other programs out there that can also assist with the management of prescription drugs as well as your overall healthcare. I'm not going to be talking about those programs in this video. I have made other videos that break down the eligibility requirements for what those programs are about, the details of how they work. And so you can go and check those out and see if that's something there that you could potentially take advantage of. The only other thing that I'll say here about those programs is that the eligibility requirements are much stricter to get into than they are for PAD. Now, what does it take to get into PAD? What are the eligibility requirements? Let's start with the basic, most obvious. You must be a New Jersey resident. Is that reasonable? That should make sense to you, okay? You cannot live in another state and get yourself into the New Jersey PAD program. It's not going to happen. The other thing that I want to mention is that if you are between the ages of 18 and 64 years old, you must be receiving Social Security Title II disability, or otherwise you won't be eligible for PAD either. But for those of you who are 65 and older, the vintage age generation, and again, you know who you are, you've got a good shot at being able to qualify for this program. The only thing that we need to look at in your world is not necessarily your assets, but how much money that you are bringing in every year, because this program has income limits for qualification. So in the intro of this video, I mentioned that I believe there's a huge percentage of Medicare beneficiaries in New Jersey that could qualify potentially for PAD, but currently are not participating. And I did some digging. I was able to find out that there are roughly 1.2 million Medicare beneficiaries living in New Jersey. And I also learned from a few different resources that the average median income for a retiree in New Jersey is around $61,000 a year. Well, the income limitations for it to be able to be eligible for PAD, you can earn as much as $53,446 per year as an individual, and you could still qualify. If you are married, that number can go up to $60,690 per year. So that leaves a huge percentage of people that are Medicare eligible that should be able to qualify for PAD, but yet only around 180,000 people are currently enrolled into that program. So with that being said, you probably have a good chance to qualify, but what exactly does PAD do? How can it help you? Now we're going to take a look at how PAD interacts with prescription drug plans, specifically Medicare, what we call Medicare Part D plans. I brought us right to the website here. I'm going to read some of this stuff and translate as we go so you get a good understanding. I know my head's probably in the way, but I've highlighted some of the things here that we need to talk about so you can really get a feel for how this works. First thing is this, PAD beneficiaries. You have to be enrolled in Medicare Part D prescription drug plan or a Medicare Advantage plan that has a prescription drug plan built into it. And if that's the case, PAD will actually pay the premium for certain standard basic Part D plans. So we have to make sure we know what plans they are with a monthly premium at or below the regional benchmark. So the regional benchmark, that just means the average cost for a prescription drug plan in your area. As long as you have a plan that meets that mark, you'll have those premiums paid for by PAD, and that could add up to quite a bit of money on an annual basis for sure. These plans, they got to cover medically necessary prescription medications under Medicare Part D. If you choose to enroll through PAD, they will actually, if you don't choose your own plan, they will assign you to a plan that meets that benchmark. But if you as a beneficiary, if you self-enroll in an enhanced plan at or below the regional benchmark premium, PAD will pay the premium just as long as that plan that you enrolled into, they agree to follow all the billing requirements. So that's where your agent comes in. They can't just enroll you in any plan. They've got to know who's working with PAD and what that's all about. But again, whether you just want to have PAD assign you the prescription drug plan or you want to pick one out, you just got to make sure if you pick your own out, you got to make sure that they're coordinating with PAD. Okay. All right. So that's a lot of money, right? But for those of you that have a Medicare Advantage plan, stick with me here for a couple minutes because you might not be paying any premium at all with your prescription drug plan as part of your overall Medicare Advantage plan. So not a lot of value there for you yet, but stay with me because I think you come out more ahead than those of you that just have standalone prescription drug plans. Let's keep going here. So PAD will actually pay any cost. This has to do with copays. Okay, so PAD will pay any cost above the PAD copayment of $5 for each covered generic drug or $7 for each covered brand name drug, including premiums. So those are the copays. Now, you could be saying to yourself, $5 for generics for a copay. The plan that I have right now, I actually pay less for generics. Hear me, you will pay the lesser of the two. You will not pay the higher of the two. So that's a good thing. Okay, remember that. But then in addition to that, $7 for covered brand name drugs for a copay, that's significant savings, especially those of you that have some complicated prescriptions that you're on to manage your healthcare. You know what I'm talking about. So there's a lot of savings there. Now, if a Medicare Part D plan does not pay for a medication because the drug is not on the formulary, let's talk about formulary for a second. Think of doctor networks, right? You've heard doctors participate in a network. Well, plans have drugs that are part of their drug network, which they call formulary. Okay, so anyway, when it comes to the formulary, PAD beneficiaries would have to switch to a drug on the Part D plan's formulary if they don't have a drug that's on there, or they can actually have their doctor request an exception due to medically necessity directly to their Part D plan. So without having to switch the drug, you can also ask the doctor there to get you an exception and see how that works out. But now we get to the good stuff here. For those of you that are on Medicare Advantage, Medicare Advantage participants must add a prescription benefit to their coverage. So like I said, if you have a Medicare Advantage plan where your drug plan is built into it, that would be you. From there, PAD would contribute up to the regional benchmark towards the prescription portion of their total premium. But going back to it, if you are one of those people out there that has a $0 premium Medicare Advantage plan for you, what is the big deal? How can this work for you? So I want you to take a step back to the last time that you enrolled in your Medicare Advantage plan. And your agent should have sat down with you and gone over a few plans. They should have explained to you that while you certainly can enroll into a $0 premium plan, there are other Medicare Advantage plans out there that have a small premium attached to them every month. And the difference between the two is in the quality of the plan. What I mean by that is that a Medicare Advantage plan that comes with a premium is going to have better overall health care. You're going to wind up having benefits that are more rich, and the cost sharing involved when it comes to co-insurance and co-pays and sometimes deductibles. Usually when a plan has a premium, all that stuff is much less. So you have an overall better health plan if you are willing to pay a premium every month. But I get it. Sometimes it just comes down to the budget every month, or you're not seeing enough value to fork out the money. But what if you didn't have to worry about the money? Because what this is saying here is that there are certain Medicare Advantage plans out there that have a premium with the drug plan built into it that PAD will actually cover the cost for. So you get into the plan as soon as you can. You get into PAD as soon as you can. And the next time that you go to enroll, the next time you have an opportunity to look at enrolling into a different Medicare Advantage plan, make sure you find out which plans PAD actually works with, where they can cover the cost of the premium for you. So not only can you have the savings potentially on the copays and but you have an overall better health plan, not just prescription drug plan. So it's a huge benefit out there that I really didn't want anybody to miss. One last thing that I'll mention. Back in the intro, I talked about that pesky late enrollment Part D plan. For those of you that did not enroll into a Part D prescription drug plan on time, and now you're carrying the weight of what they call a late enrollment penalty every month in addition to what you're paying in your other premiums. Good news for you is that PAD will actually pay that late enrollment penalty for you each month. So there's even more savings there if you happen to be the small percentage of people that fit into that category. So definitely needs to be something that you get yourself involved in as soon as possible. So we're going to talk about next the how do you get enrolled? What's the application process look like? Okay, so how do you get started with PAD? Well, I was told many times over the years that the best time to plant a tree is a couple hundred years ago, and that the second best time is today. And I feel the same way about the PAD program. I want to warn you that the wheels of government have a tendency to turn slow, especially in the state of New Jersey. We are seeing PAD applications right now turning around in as long as 4 months, 120 days, sometimes even a little bit more than that. Okay, so it's going to take some time. Now, in order to apply there, you've got two options. The first way is you can simply call a phone number. We're going to put that phone number down in the description, and you can call in and request for the state to send you out a paper application, which you can go through and fill out. And you could also do it digitally online. We'll put the link there directly for that as well, so you could get started that way if you choose to do so. It's not the easiest thing in the world for people that don't like filling out paperwork. So you might have some questions. We want to offer some support and help there. I'll tell you how we do that in a second. In addition to filling out the paperwork, you're also going to have to send in supporting evidence of what your income is. And so we're going to put together a checklist for you to get your hands on down below there. So you know when you send off your application, before you even start filling it out, I would actually recommend that you take the time to gather up the supporting documents that you're going to need so you can get it all done at one time. The last thing you want to have happen is fill out the paperwork correctly, send it in, but then have forgotten to send in the supporting documents, which is just going to delay the process even further. All right, so we want to make sure that we give you some help there. But what if you're somebody that you just hate doing this sort of stuff? You're not good at it. It's confusing. You get frustrated. And when you're not sure what something means, you can just kind of bury your head in the sand and forget about it. Well, I want to offer you assistance. We have a very small but mighty team, and we have learned over the years how to help our clients get through this application process with the PAD program. So you can actually reach out to us, whether you're our client or not. Most likely if you're watching this, you're not one of our clients, but we're still more than happy to be able to give you assistance, answer the questions that you have with filling out the application so it is submitted correctly and you could get into the program as soon as possible, which is a good thing for you to have for sure. So make sure that you reach out to us, and we'll put a link there for our website, and there's a contact form there. You can request a phone call or an email. Somebody on our team will reach out, we'll schedule a time with you, and see where we can help you out at. And that's on us. There's no charge for anything like that. Our goal is to continue to help our community as much as we possibly can. All right. So with that being said, and that we understand what the application process is going to look like, as I said earlier, some of you watching this, you'll be like, well, this is all great for everybody, but I don't qualify. I get it. There's still some value here that I'm going to provide you. There is an alternate program to PAD. It's called Senior Gold. And basically the income requirements for that program, it's just $10,000 more for if you're single, or $10,000 more if you're married. So you can actually, if you exceed that threshold, you still may be able to qualify for Senior Gold. What that program is going to do, it's going to give you $15 copays across the board, plus 50% of the cost of whatever that prescription drug plan may be. So there's an opportunity there to potentially be able to save some money there. It's an alternate to PAD. It's not as strong, but at the same time, it's a good way to be able to support and manage some of those costs that you have there. And the good news is it's the same application process. All right, they're just going to put you into whatever the qualification is. And then, look, some of you are going to even be boxed out of that program. God bless you if you're in a little bit more of a financially stable spot there and are not eligible to take advantage of those programs, but there's still a better way for you to manage your prescription costs throughout your plan year to put you in more control over your money. It has to do with a new law that just came into place in 2025, the plan or the year that we're in as I'm recording this video. So let's talk about how that works. Okay, last thing before we wrap up, and this is again for those of you that aren't going to qualify for either the Senior Gold program or PAD, but you'd certainly like some options there to potentially manage your prescription drug costs throughout the year. So this is for you. And as you can see here, I just pulled up a website here, a nonprofit organization that explains this, but I'll just read it and we can go along. The Medicare prescription drug plan is a new voluntary Medicare Part D payment option going into effect January 1st of 2025. This is something that patients have to opt into. And here's the crux of it. The program lets you spread out your out-of-pocket drug payments throughout the calendar year. It's not going to lower those costs, but you can opt into this program through both traditional Medicare and Medicare Advantage Part D drug plans. So what you can actually do, instead of paying out your out-of-pocket expenses, whether it's deductibles, copays, and your premiums, you could essentially contact your prescription drug plan carrier and say, I want to be a part of this payment plan option. And what it will do, you'll never have to pay when you go to a pharmacy. Certain people in the beginning of a plan year, they've got deductibles and high copays for prescription drugs. I mean, the first quarter of a new year can be expensive for people, but this is a way for you to now smooth that out. They call it like a smoothing option. And it's something that's brand new. They talk about in this article, and you see even when you go to Medicare.gov, that your plan provider should reach out to you and let you know about the information. And I'm sure that they have in your summary of benefits before you enroll, all that fun stuff. But they don't advertise it. You have to kind of dig around a little bit there because it puts the onus on them. You wind up getting a bill directly from the carrier, and you never have to pay when you go to the pharmacy. You always be able to go and pick up your drugs, and then you're just going to wind up paying back through over the course of time with your drug plan, which is a way better way to manage your money, in my opinion. So I'm going to put together a whole entire video that really breaks this program down in depth, but I wanted to make sure that I shared this with folks. If you watch through the rest of this and you find out that you're just not eligible for Senior Gold or PAD, this is still a way for you to be able to get some value from watching through and managing your healthcare. So, all right, so action steps here for us as we wind down here. Look at the description in the video below. You can find the steps there of how to get an application in your hands. You can get the checklist there as well. And you also have some information there on how to contact us for free assistance to be able to get that application submitted. And even if you just have some general questions, it does not matter if you are our client or not. We're happy to be able to answer some general questions for you in regards to this program or anything that has to do with the with Medicare or any other type of insurance. We want to be there to help you. If you thought this video was valuable, our only ask is that feel free to leave us a comment with any questions. But we'd also ask you, if you like this kind of content, go ahead and hit the subscribe button and also give the video a thumbs up. With that being said, thanks for watching, and we wish you the best of luck.